Good morning, everybody. Today, I'm not here to host an event, but to conduct a training session on occupational health and safety. Okay, though comparatively, this is a very easy topic which everybody can understand, but it is a very important topic for everybody in an organization. It can be a nurse, a technician, a doctor, a pharmacist, anybody. So, before I start the session, I have a small pre-test for you. So you know the drill. Kindly scan the barcode. 5 minutes. Quickly give the pre-test. In the questionnaire, please select as pre-test. Okay, you have two options: pre-test and post-test. Please select pre-test when you're giving the pre-test. You can come forward if you want, scan, and then go back to your seats. Please come forward. We have many seats empty. Please scan the barcode. Quickly give your pre-test. Done? Can we start the session? Those of you who came just now, quickly scan the barcode and give your pre-test. People who have come just now, please scan the barcode and give your pre-test. We are going to start the session. It's not a group discussion, please. Okay, before I start the main topic, few simple definitions that everybody must and should know to understand today's topic on occupational health and safety. What do you mean by the word safety? Nobody's paying attention. Please get done with your pre-test. It's only 5 minutes. Or else I have to force you to keep your phone down and then pay attention towards the screen. Okay, please stop your post-test, pre-test, sorry. Yes. So what is safety? Safety is the absence of risk of personal injury. What do you mean by injury? Any workplace has certain risks or hazards present. Yes, even though risks are there, still you are able to work safe is considered as safety, right? If you're going home like this after your work, at your workplace you get injured so badly, then it is not considered as a safe working environment. Now, what is an accident? Anybody? What do you mean by the word accident? We've discussed this many times during nursing training programs as well. Accident is an unplanned, unwanted event which leads to injury, damage, or loss. Yes, probably an accident. Now, what is a hazard? Something with the potential to cause harm. That's a hazard. Yes, this is a fire hazard or a flammable hazard. What is an occupational hazard now? You've seen safety, you've seen hazard. Now, what is an occupational hazard? An unpleasant, inconvenient, or unusual circumstance which occurs or is likely to occur during the course of one's employment. It's all related to your workplace environment. Any hazard that can cause or has the potential to cause injury or harm to an employee or a worker is referred to as occupational hazard. Some happen because of mechanical error, because of technical problems. Like you see this, one simple event of a mechanical failure led to a major accident or an incident. Sometimes it happens purely because of the negligence of human. You do not use the equipments properly which are intended for a particular purpose or use. So these types of accidents happen purely because of human negligence or ignorance. Like fall from height from a working platform which is not designed for a elevated work platform. Why is occupational health and safety important? Why are you guys here today to understand this topic? Everybody knows what is safety, what is risk, but why is it important? Work plays a central role in people's lives. Yes, since most workers spend at least 8 hours or more at their workplace, whether it's a construction site or an office or factory, for us it's a hospital setting. Therefore, work environment should be safe and healthy. Do you agree? But every day, workers all around the world face with multitude of health hazards. Now, why must you know about occupational hazards and safety? Well, it's very simple. The human body has an immune system which is designed to fight any kind of problems or anything that attacks you, and it helps you recuperate or regenerate. Yes. However, there are hazards like bacteria, viruses, chemicals, dust, vapors, noise, extreme temperatures, and work pressure to which you may be exposed to at work in general or in a general environment that also has the capacity to break you down or weaken your body's immune system. Since your body's defense system cannot always win the fight against these hazards, it is important for you to learn what hazards exist in your workplace and what controls are necessary to prevent exposures. Hazard awareness will help you when you work with your employer to eliminate these hazards. Now, what are the different kinds of hazards that are present in a workplace? Some of the common hazards that we refer to are chemical hazards. Yes, we do have a lot of chemicals at our workplace. Physical hazards such as noise, vibration, unguarded machinery, unsatisfactory lighting, radiation, extreme temperature, either hot or cold. Biological hazards like bacteria, viruses, any infectious waste. Psychological hazards resulting from stress and strain. And non-application of ergonomic principles resulting in poorly designed machinery and tools or poorly designed work practices. So these are the categories of hazards in a work environment. Of course, we are exposed to biological hazards like infectious waste, all the disease causing microorganisms, and because of our poor body posture, we end up with neck pain, back pain, shoulder pain, muscle cramps, etc. Now, is there any implication of these occupational hazards on our lives? How does it affect us? Yes, there is a cost. Two costs basically, direct cost and indirect cost. What are direct cost? The pain and suffering from the injury or the illness, the loss of income, the possible loss of a job, and healthcare costs that are associated with the injury. For example, you were working in your nursing station, you fell down, you broke your arm, you have a fracture. All those that come with that, the medical bill, the pain, the loss of income. What if somebody has lost their leg or hand at their job? They are at a risk of losing their job, right? What if you need your hands to perform one particular activity? It means you are at risk of losing your job. All these come under the direct costs. And what are indirect costs? Because of this, your family is getting affected. All that comes under an indirect cost. Correct? Indirect costs cannot be compensated with money. Hence, it is imperative that everybody must know what are the different types of hazards that are present at your workplace. Now, whom does occupational health and hazards affect? We are working in a healthcare setting, so let us look at few areas which actually everybody is affected by occupational health hazards in a healthcare setting. Broadly speaking, nursing staff, the OT staff, lab, CSSD, radiology, laundry. Of course, we do not have in-house laundry, but there are people who are working with linen as well. Housekeeping staff, maintenance and engineering staff, the F&B staff also. So how can you identify health and safety problems? Yes, we are talking about hazards. Yes, they are present there. But how can you identify these problems? One, observe your workplace. Everybody has a concept of hazards through experience or through learning, right? You should observe your workplace and identify what are the risks or potential risk that has the ability to cause harm or injury. Investigate complaints from workers. Now, many people might report that this working environment is not safe for me. So we should investigate from a management's point of view, what is the risk of working in such a work environment. Examine accidents or near miss records. That is what we as quality department do. Every incident that is reported is looked at very seriously till the point where we do an RCA to find out what is the exact reason for an incident or an accident. Examine sickness figures. During COVID, we identified most of our staff were, falling sick. They were getting infected, or there might be some other reasons also, like people are complaining about back and neck problems. So you try to identify whether they are lifting weights. Are there any mechanical aids provided to them? Yes, people complaining of muscle pain. Yes, or the environment is too cold for them to work. They are repeatedly complaining, but there's no response. So these are complaints that you can look at to make the work environment conducive for the workers or employees. Then use simple survey to ask your co-workers about their health and safety concerns. So we can do a questionnaire also. So we can listen to what you have to say or what is your perception about the organization health and safety policies. Then use checklists to help you inspect your workplace. We do regular rounds of the facility to identify anything that has a risk or potential to cause harm. Learn from the results of inspection that are done by the employers, external agencies, or anyone. So these are ways how we identify health and safety problems. Now, what are the common workplace hazards? So this is coming to the core topic. What are the hazards that are present in a healthcare setting? Most common, needle stick injuries. 32 needle stick injuries were reported at AIG Hospitals in the year 2022. 32 needle stick injuries. That is a very big number. Hazardous materials. Yes, this poses a very great risk for any healthcare worker, and we all are at one point in contact or in exposure to these hazardous materials. Entanglement hazard. Any rotating part or machinery which is not properly guarded or protected, it has the ability to pull your dress inside, and with that your hand might get in and get crushed. This is called an entanglement hazard. Crush injury. Crush injury can be you're just walking and you hit the nursing station table, or you just hit your toe against a sharp object. All these come under the crush injury. Or in an emergency, the crash cart was being wheeled in by one of the nurse. She went and hit somebody else. That is also a crush injury. Fire hazards. Yes, hospital, since there is oxygen, medical gases which are flammable and combustible, there is a high risk that we have fire hazards in a hospital. Electrical hazards. Yes, we have different sources of electricity in a hospital. One, the direct and the UPS. Even our electrical boards are labeled as electrical, and the main distribution panels you find do not touch, do not operate, warning, high voltage. So don't play fool with anything that has electrical supply. The UPS supply is so strong that within seconds, if you are in direct contact with the UPS power source, you're dead. That is the amount of electricity that the UPS can generate. So please don't plug in any loose wires or don't half plug in any biomedical equipment. Exposure to highly contaminated areas. This you are very familiar with. Any area that you take, depending on the colors, it is least contaminated to most contaminated. Trips. So there are many trip hazards that are present in your work environment. You might trip here on the stage, you might trip on your nursing station, or you might trip on the staircase. Trip, slips and falls. In 2022, again this is our internal statistics, 53 falls were reported in the year 2022 at AIG hospitals. So on an average 4 falls a month. Slips in the kitchen. Kitchen is a highly slippery area because of the oily fumes that get generated and settle on the tiles. If you have visited any industrial size kitchen, you will find the floor extremely slippery, and you have hot oil present in every industrial size kitchen. Bed bugs and allergies. Yes, there are many allergens present in a healthcare setting, so these also can cause allergies or some kind of health hazards to you. Manual handling and musculoskeletal injuries. This is when you do heavy lifting or repeated lifting or repeated movement of one particular muscle. You will exert strain and stress on that muscle and you might end up injuring yourself. Hazard identification and risk assessment. Now we've discussed a few of the hazards that are present in a healthcare setting. But how do we identify these hazards? There is something called as HIRA, or Hazard Identification and Risk Assessment. We have the Hospital Safety and Disaster Management Committee that has appointed 10 different safety officers who do take part in the organization risk assessment. Now I will give you in brief how we do a risk assessment in any setting. So these are the different safety officers that are appointed at AIG hospitals. One is the Clinical Safety Officer, Dr. Naveen Chandra Reddy, Infection Control Officer, Dr. Pragati, Patient Safety Officer, Ms. Anuradha, Hospital Safety Officer, Mr. Nageshwar Rao, Radiation Safety Officer, Mr. Mallikarjuna, Lab Safety Officer, Ms. Sunita, Hazmat Officer, Mr. Ashok, Fire Safety Officer, Mr. Abdullah, Medication Safety Officer, Dr. Santosh, and Group Security Officer, Mr. Jaypal. So you should know who all are our safety officers, so that in case you identify any safety hazard, you can directly get in touch with them and inform them about any safety deviations. Now, as per JCI, risk assessment has to be conducted in these 8 areas. One is safety, security, hazardous material and waste, fire safety, medical equipment, utility system, that is engineering, electrical, plumbing, and your HVAC unit, emergency disaster management, and construction and renovation. How do you calculate risk? Risk has a formula. It is probability into severity. Now, how do you calculate these two? For example, if a risk or a hazard is occurring in less than a day, okay, you have every day one fall happening in the hospital. So the probability is often, that is 4. Needle stick injuries happen less than a week to a day, then it is likely to happen, so 3. And needle stick injuries from a positive patient, it is maybe less than a month, you have 1 incident, so the score is 2. Fire accident, more than a month to a year, so you give a probability score of 1. Now, because of this incident, what is the severity, or how does it affect the person? It can be no loss of time, not reporting to work for 48 hours, that is a reportable injury. It causes disability or loss of an organ, that is a major category, and if it causes death, it is 4. So now you give probability into severity and you quantify all the risks on a matrix. This is the hospital hazard and risk quantification matrix. So all those that come under green, that is 1, 2, 3, you can work and have to escalate to put in certain measures. Now 4 to 8, which is in yellow, which is moderate, you need to put certain control measures, and 9 to 16 is high risk. Activity cannot be performed in that particular way. You have to stop that activity so that you can put in certain control measures. Hierarchy of control measures. This is one thing that we learn in health and safety. When you know that there is a problem, you need to put in certain control measures. So first, it starts with elimination. You should try your best to eliminate the hazard from the workplace or the work environment. That is, physically remove the hazard. Then substitution. You try to replace the hazard or your work practice system or the equipment that you are using, so that the hazard is replaced with a less hazardous activity. Then engineering controls. Sometimes you use mechanical lifts, hoists, yes, or your needles have retractable needle which has a rubber coating. All these are engineering controls which reduces the level of risk of harm or injury. Administrative controls. These are rotating shifts, or you take a break in between. Now nurses are posted on 8-8-12 shift, yes. Why not on 24-hour shift? Because you go through certain level of stress and strain, and there are administrative controls given by councils to address occupational risks and hazards. And then last comes PPE. PPE is not the first hierarchy of control. Of course, in a healthcare setting, PPE is given very high priority. Even now I see everybody in wearing masks and everything. So this is the hierarchy of controls. When you have identified certain hazards, you put in certain control measures. Now, the committee, those 10 safety officers that we discussed, they do a proper risk assessment for all those 8 areas. This is an example of a risk register. We will put up departmental wise risk registers on the AIG portal, so that you know what are the risks that are present in your particular department and what control measures are already in place to reduce the level of risk. Now, Let us look at certain control measures that we have discussed. Very common, needle stick injury. So you all know what you have to do in case you sustain a needle stick injury. We have a needle stick injury protocol. You know whom to escalate, when to escalate, what to do and what not to do. Yes, what will you do in case of accidental exposure to blood and body fluids? In case it goes into the mouth, in the eye, or on the skin. So you must know where are your different locations where eye wash are present. Yes, do you all know where eye wash is present in your location? If you do not, please go back to your working stations in your next shift and identify where is the nearest eye wash station. The other control measure that we have put in place to reduce exposure to biological hazards are biomedical waste segregation. Is there a way of eliminating biomedical hazards? No, it is generated and you have to work with it and you are exposed to it. But what did we do? We substituted it by handling it differently. Yes. So you know in which bin what color waste goes and how we minimize handling those wastes directly with our hands. Then radiation safety. There are multiple caution signs that are put in place in the hospital to alert you of various on-site hazards present. Always wear your PPE. So whenever you are there in your department, please make sure that you wear your TLD badges, your lead aprons and the gonad shields. These are warning signs about chemicals. Some are corrosive. So chemicals have different kinds of effects on your body. Now how does chemical affect you? Through inhalation. If you breathe in the chemical, through absorption, through skin or splash in the eye, through ingestion, if it goes directly through the mouth or mixed in the food, inoculation when sharp objects such as a needle puncture to the skin. Cytotoxic drugs is another high risk chemical that we use in our hospital. So there are special precautions that you need to take while handling or discarding cytotoxic drugs. So be cautious while handling such waste. So you know what is our policy. We label all those bags with this particular sticker. Then you have MSTS present for all the different types of chemicals that are present in the hospital. You should know the contents of your spill kit. Everywhere you have a minor and a major spill kit, and at the back side of the spill kit or on the lid of the spill kit, you have a spill kit protocol attached. So you have different types of spills that happen in a hospital. Blood spill, urine spill, cytotoxic spill, etc. or a radioactive spill. So we have given a spill protocol to easily let you know what are the steps to be followed in that type of spill management. Then this is the most easiest control measure which everybody has to follow, a proper hand hygiene technique or a hand wash technique. Then for any other on-site emergencies, we have developed these hospital emergency codes. So we had a separate session on how to initiate a code, who will respond, and what happens in the case of a code blue or code red or code yellow. Recently we conducted a code orange mass casualty drill to see the response of the team in case of a real scenario. So everybody must know what are the emergency codes at AIG hospitals, how to activate an emergency code, and also how to clear an emergency code. So these are also different kinds of hazards that are present in a workplace, mainly slip, trip and falls. Mostly patient falls are only reported in the hospital. Please make sure even employee falls are reported. Even if it is a near miss, please make sure that you report it as an incident or a near miss. How do we ensure safety at AIG hospitals? So these are few safety devices that are present to ensure safety or to avoid fall of a patient. There is a call bell system that is installed. Now the new one has been installed. This is again to avoid falls of patients or unnecessary movement of patients. Safety signages. Anywhere you go in the hospital, at every 10 feet you will find some kind of safety signage that is installed. Now it is your responsibility to understand what is the safety signage trying to tell you. It can be a warning signage, it can be a caution signage, it can be a mandatory signage which is telling you you must wear your PPE, or it is a danger signage. These are no smoking signages, again we have put up to ensure that the hospital is a fire-free zone. As per statutory requirements, smoking is not permitted in the hospital premises. Now, again, there are different kinds of signages that are placed to alert staff, patients, visitors about the on-site emergencies that are present. Fire safety signages or fire exit signages. So these are put up everywhere in the hospital. You should know how to read the emergency evacuation board. Which is your nearest fire exit, or which is your alternative fire exit? Where do you go in case of a fire emergency? And what do you do in case of an emergency evacuation? So all these have been trained in different fire safety sessions. So you need to be aware of these safety signages. Now, hazardous material. This is also another important topic in the healthcare environment. What is a hazardous material? It's a material, chemical, either liquid or solid, that presents a danger to personal or property. This danger can be classified as toxicity, instability, flammability, combustibility, or corrosivity. It means if it falls on your skin might get burnt. So we have a hazmat program, we have a hazmat policy, we have prepared the MSDS, we have adopted a labeling system that I'll explain now, and we have a inventory, hazmat inventory of each nursing station or each department, and employee trainings are also conducted on hazmat. Have you seen these labels anywhere? Yes, everywhere in the hospital on any chemical bottle you must have seen one of these stickers. This is called the NFPA Diamond Labeling System. NFPA stands for National Fire Protection Association. Now what do? For each chemical, they have identified different types of hazards and they have given a classification. Now each color diamond represents a specific type of hazard, and the numerical rating in that gives the severity of the hazard. The NFPA labeling provides at a glance hazard information. Now, the blue diamond indicates a health hazard. It means in case you accidentally get exposed to that chemical, it has some direct or indirect effect on your health. Red is flammability hazard. It means that particular chemical has the ability to ignite or catch fire or explode. This depends again on the severity. It can burn or catch fire at a very low temperature, or it can ignite or blast at a high temperature. Instability hazard. Any chemical which, if in case it mixes with any other chemical, or if you shake it very vigorously, it has the ability to explode or react. Best example is our Coca-Cola thumbs up bottle. What will happen if you shake it very vigorously? It reacts. Yes. Now white is a specific hazard. It can be acid, base, radioactive, or do not mix with water. There are certain types of hazards that are mentioned in the white diamond. Let us look at an example. Now, this is the diamond, and you will see numericals in each of those diamond. Now in 3, in blue diamond, which is health hazard, number 3 is mentioned. It means it is a severe hazard. 4, in red, it is deadly. Even at low temperatures, the chemical can catch fire. Now in W dash, in the white diamond, that is specific hazard, it means you should not mix that chemical with water. If you do, that chemical can release toxic fumes, or it can even ignite or blast. We have kept this at every nursing station for you to easily understand or interpret what is the NFPA labeling system. If you see in the blue diamond, if it is 1, it means slightly hazardous. If you see 4, it means it is extremely or deadly to your health. And in red, there are different flash points. Flash point is nothing but at what temperature a chemical can catch fire. Okay. And in yellow, they have given unstable if heated, violent chemical change, shock may detonate or may detonate, that is explode. And in white, you see a radiation symbol, you find a W and a dash, then you have COR, which means corrosive, then you have acid or oxidizer. So let us see one simple example. Yes. So what do you think? So in blue, it says 3. So how risky is this? Good morning, everybody. So how risky is this to your health? There is 3 in the blue diamond. It is extreme hazard. Very good. In 4, in red, it is given as 4. It means it can burn at 73 degree Fahrenheit. That is very low temperature and it can catch fire. In yellow, it is 1. It is unstable if heated. And in white, it says W and a dash. So what does the interpretation label say? Use no water. You should not mix this chemical with water at any point. So we have given the hazmat inventory with the NFPA rating for each nursing station or each department. So on the AIG portal, you will find this tab. This is one example of the hazmat inventory in the cath lab. So what is the chemical present? What is the chemical name? What is the average quantity that can be stored? And each chemical has a NFPA rating. So what are the PPEs that you're supposed to do? And how do you manage the spill? MSDS is another important point that you have to remember. What is a MSDS? Material Safety Data Sheet. What does the MSDS give you or tell you? It's basically what is the chemical present, what is the chemical composition, how do you store the chemical, how do you handle it, how do you transport it, in case of exposure, what is the first aid or what do you do, and in case of spill, how do you contain or manage the spill. This important information is given in one single sheet, which is recently updated for all nursing stations across the hospital. Now, what is your responsibility when it comes to safety? Do you have any responsibility when it comes to safety? Yes, no? First, you have to be aware of the occupational hazards that are present in the organization and your respective work locations. Yes, do you agree? To know the control measures the organization has put in place to reduce the risk. To know the list of hazardous chemicals used in the workplace. To know the location and the availability of MSDS. Where should the MSDS be present? It should be present where the chemicals are stored, and it should also be present where the chemicals are being used. Okay. You should know the NFPA labeling and the rating system. You should be able to know how to interpret the NFPA hazmat labels. You should be able to communicate physical and health hazards to co-workers. That is what we are doing. To use all personal protective equipments whenever needed. To report any occupational related injuries on the AIG portal using the online incident reporting form. We have a health and safety policy that is already being designed and it is available on the AIG portal. So we as an organization are committed in promoting a culture of health and safety. Also in the FMS chapter, you have the hospital safety program. All the topic that I just discussed is elaborately discussed in this particular manual. So just you can search the type of hazard that you want to know about and you can go through the hospital safety manual in detail. Any questions? If not, I have a post-test questionnaire. Quickly scan, select as post-test and then submit. I hope we were able to create some bit of awareness on occupational health, safety, and hazards in the work environment.